This study is about risk factors for dementia in Northern Ireland. This study is only part of a bigger project on dementia analytics that we run at Queen's University, Belfast in Northern Ireland, and is funded by the Atlantic Philanthropies, the Executive Office in Northern Ireland, the Department of Health, and we would also like to acknowledge the help and support provided by the Honest Broker Service staff. It is estimated that there are approximately 19,000 people with dementia living in Northern Ireland, and this number is expected to increase to 60,000 by 2050 because of the prolonged life expectancy. Literature has shown some risk factors in mid and late life that might predict the dementia diagnosis on late life, and these factors can be modifiable or non-modifiable. Some examples are hypertension, obesity, and diabetes. So this study aimed to explore the risk factors for people living in Northern Ireland. The initial plan was to use data from the GP Intelligence platform, which is a platform that has been developed in Northern Ireland and links data across the GP services. However, and because the GP staff was not available to extract data because of COVID work, we had to use data from the Enhanced Prescribing Database, which is a database including data for all medication prescribed by GPs and bought by pharmacies in Northern Ireland. We selected the dates between 2010 and 2016, which had the best completeness in the database, 80 to 90%, and we used dementia medication as a proxy for identifying which people had dementia. We also extracted data from an age and gender matched control group. Unfortunately, because of the nature of the data, we could only identify a small number of risk factors like hypertension, high cholesterol, depression, and diabetes. And this is only for people's late life and not from midlife. All the data was linked through the Honest Broker service. So we identified 25,000 people, 418 people with dementia between 2010 and 2016, and data was extracted also for an age and gender matched control group. All of the risk factors under investigation were non-significant, so we couldn't say that the presence of hypertension, high cholesterol, depression, and diabetes affect and predict a future diagnosis of dementia in this case. However, we strongly believe that the non-significant results were because we didn't have access from midlife data, because past research was conducted on people between their 40s and 60s, and then people were followed in their late life. However, we didn't have access to this data, so this could explain our non-significant results. Another limitation of this study was that we identified people with dementia through their medication. So we mainly captured data from people with Alzheimer's disease or mixed dementia or Lewy body dementia, but not from other types of dementia. And the biggest limitation of our study so far was that data were not available through the GP platform. Thank you.